I just want to help people that are looking for some other alternative for their current condition, to help them in a way to live a better life. Especially in Malay community, we are not exposed to functional space. So maybe I can help the few Malay that need elderly, or maybe they need some sort of advice to have a better life or to reverse certain chronic disease. Hello, my name is Dr. Siti. I'm a functional medicine doctor. I'm a new addition to the actual clinic. I graduated from my medical school in 2010. So I have a background of acute care medicine for like 13 years, primarily in both government and private setting. People that fast thinker like emergency because you need to have a fast diagnosis, fast plan and fast referral. When I did my internship in emergency, that department kind of speak to me also lah. If you deal in emergency cases, resus, you cannot really take your time. The patient is dying there, so you cannot like what to do. So you kind of need to think on the spot. Okay, then the pak, something like that. So it's kind of like me lah. No one really remember you in an emergency, but it's actually very important in any emergency setting like the life-threatening situation. But you don't really treat the patient from A to Z, but you save them when matter. After you did your job for like more than 5 years or something, there's a certain limitation you can see in the managing of certain complex chronic disease lah. So because of the tools that they have is only pharmacological drugs, which is most of the time only treat the symptom. So symptom relief is very good in acute practice like emergency, GP setting is okay, but not in a complex chronic disease. It's not good to put patient on the long medicine for symptomatic relief. So you will see the limitation in the space of autoimmunity, in the space of cancer treatment. So in a sense, they don't really think the difference between each individual lah. You need to consider that when you're managing the patient as well lah. So that's where the functional space I think do better in the managing of the complex chronic disease lah. So I quit my job about 2 years back. Then I start going into the preventive care in a GP setting initially. So from there on, then I come across a talk by Professor Roberto regarding precision medicine. So whereby they show all this connection intertwined between the gene and also the functionality of your organ and system, which in a way propel me to come into this direction lah from my acute care medicine. Before this, I always thought that functional medicine is actually only work kind of like alternative treatment. It was not known to me it's actually have some scientific or fact-based background. When I know about this, I become more interested lah of the functional space and the precision medicine also lah. It's actually quite personalized the approach and holistic. They don't really treat a symptom only lah. Then I proceed to my study in nutritional and functional medicine, and from there on you come across multiple information. You start to learn all this journal. It's more like a self-realization that actually I don't do what's best for patient in a way. Especially in complex chronic disease, there's a better way out there that can actually address the problem without actually damaging or cause further worsening of the disease itself lah. Maybe we can reverse certain condition to a better state if we actually give what's the body want lah. Functional medicine doctor is actually, they understand human body better if you compare to allopathic medicine doctor lah. So that actually very intriguing lah for me. Well, because it can help patient if you're managing complex chronic disease. So I kind of get like my childhood dream in one, like a detective and also a doctor. So together, so I think that's the reason I come. But I don't hate my emergency background. I actually still love emergency. After that, I start applying for nutritional medicine professional licensing. Then here I am. There's an obvious limitation in conventional space to treat depression and anxiety, and you can address it in different manner in functional space lah. Mental issue is an evolving issue. I mean it's worsening if you ask me nowadays lah, because of the pressure of the society, all these financial things, modernization of the world. It's a problem if you ask me, especially for female lah. So I was thinking maybe female space, female hormone and female related depression, anxiety, somewhere along that space.
True healing starts from the mind. I'm Dr. Siti. Follow for more advice.